It's been another dark day for Cumbria, with the county hitting another dark record, albeit not one anybody wished for. Infection rates in the county are now the worst they've been, but the man in charge of the public health response says while he's extremely concerned, infection rates are slowing.
We're still seeing infections at a very high rate across the whole county. However, it does look as if infection rates appear to have stabilised a bit and may even be starting to drop a little bit. So the situation is difficult, it's challenging, but we're not seeing the exponential rises that we were seeing this time last week. By the end of this week and into next week, we'll start to see the impact of lockdown coming through properly, because that will be a full 10 days then after the lockdown measures were in place, and we'll be seeing the data coming through from that. And we'll start to be able to make some clear judgments on the impact of lockdown towards the end of this week and into early next.
The figures show just how serious the problem is. In the 7 days to last Friday, 3,489 new cases were confirmed across Cumbria. That's an increase of 39% on the week before. And for the fourth week in a row, Carlisle had the greatest number of those new cases, with 1,251. Pressure is being felt most at the county's hospitals. In North Cumbria, the number of COVID-19 patients was up 68% on the week before.
Well, the current situation is still very, very stretched, particularly for the NHS. Hospitals are very much at capacity across the whole of the north of Cumbria, and getting to that point in the south as well. Numbers of cases in hospitals are rising still in both the north and the south of the county.
Figures for the number of people who've died show there were 25 deaths in the week to the 1st of January. Michael Wilson worked as an electrician for the NHS in North Cumbria. He died with COVID-19 on Saturday. He leaves behind his wife Kimberly, his 12-year-old son Harry, and his 7-year-old daughter Arabella. North of the border, and for a time last weekend, Dumfries and Galloway had the worst infection rates in all of Scotland. Over the last week, the picture has been improving, but health bosses say it's too early to take too much comfort from this drop.
What we have seen is a slight improvement in the number of people testing positive in the community. However, I think I need to stress that will not impact on the effects we're feeling in the hospital for several weeks. So it's a glimmer of hope, but we are still in a very grave and precarious position.
In Dumfries and Galloway, there were 513 new cases during the 7 days before the 11th of January. That gives the region an infection rate of 344 cases per 100,000 people per week. That figure's down from more than 500 the week before. In the Scottish borders, there were 291 new cases, creating an infection rate of 251 cases per 100,000 people per week. Despite the increase in infections slowing down, pressure on our region's hospitals will continue to rise. That's because the people being treated now were infected at the start of the year, before infections reached their record high. Health bosses fear that this might be a sign of infections simply levelling off, not dropping, putting the NHS under a sustained period of pressure. Lewis Warner, ITV News, Dumfries.